Next, we talk about phlegm damp obstructing the lung. This pattern can occur when the chi mechanism of the lung is disrupted by repeated invasions of exogenous pathogenic chi, or when the spleen is not able to separate the pure from the impure, resulting in damp and phlegm arising in the middle jaw, which are then sent upwards along with the pure gu qi to the lung. According to Chinese medicine, phlegm is created by the spleen and stored in the lung. This means that in chronic conditions, when there is damp phlegm in the lung, the spleen must also be tonified at the same time. The presence of damp phlegm will block the spleen and lungs chi mechanism, and this blockage can then lead to the further formation of phlegm dampness. Concept, this is due to spleen chi deficiency or chronic cough damaging the lung, or a wind cold damp pathogen invading the lung, all of which lead the damp phlegm to obstruct and stagnate in the lung. Key symptoms, cough with profuse white sticky sputum that is easy to expectorate. Clinical manifestations, cough with profuse white sticky sputum that is easy to expectorate, chest stuffiness, even asthma and wheezing, pale tongue with white greasy coating and a slippery pulse. This pattern can be seen in both acute and chronic diseases, however, mostly seen in chronic diseases. Damp phlegm in the lung can arise from invasions of exogenous pathogenic qi that disrupt lung qi and block the transformation and spreading of fluids. Spleen qi deficiency and dampness are often at the root of an accumulation of damp phlegm in the lung. The spleen is particularly burdened when the diet contains a lot of food that has a cold or damp energy, or when the food and liquids consumed are physically cold. The pattern can also arise through the use of medicines that are energetically cold. Posture can be a contributing factor. If the person has a tendency to sit stooped or slumped, it will block both the spleen and lung chi mechanisms. This will lead to the formation of damp phlegm in the middle jaw and the accumulation of damp phlegm in the upper jaw. Emotional factors such as sorrow or worry can affect the lung and spleen, and this may be a contributing factor to this pattern. So again, the etiology of phlegm dump obstructing the lung would be invasion of exterior cold, poorly expelled, overexertion and poor diet over long period, excessive consumption of greasy or cold raw foods leading to phlegm dump production by spleen, settling in the lung, chronic spleen or lung yang deficiency. Signs and symptoms, cough with easy expectoration of watery white sputum, aggravated by exposure to cold, aggravated by physical movement, feeling of cold, cold hands, phlegm in the throat, dizziness, feeling of fullness and oppression in the chest, feeling of cold in the chest. Pulse is slippery and slow. Tongue swollen and wet tongue, sticky white coating. Treatment principle, transform phlegm dump, regulate waterways, descend lung chi, suppress the cough. Acupuncture treatment, we use lung 5 to clear phlegm from the lungs. Ren 17 to supplement lung qi, bladder 13 to supplement also lung qi, Ren 22 to diffuse the lung, transform phlegm, Li 4 to release the exterior, pericardium 6 to loosen the chest and rectify the qi, lung 7 to descend lung qi, Ren 12 to resolve phlegm, bladder 20 to supplement spleen and resolve phlegm, spleen 3 to support the spleen, lung 9 supplements lung yin, and stomach 36 to transform damp. Needling, even method. It is essential that the person with damp phlegm in the lung avoids consuming damp and phlegm-creating foods and beverages, especially dairy products, sweets, wheat, sugar, bananas, avocados, dried fruit, and so on. They should also avoid consuming cold, refrigerated foods, foods that have not been cooked, and eating regularly, as this eating irregularly, no? As this will strain the spleen and can lead to formation of dampness and phlegm. Correct body posture and exercise are important in order to avoid stagnation and blockage of the chi mechanism in the upper and middle jaw. Repeated invasions of exogenous pathogenic factor can be a contributing factor in the formation of dampness and phlegm in the lung. This means that the patient must make sure that they are suitably dressed and do not expose themselves to invasions of exogenous pathogenic qi. Beating the chest and the upper back with a loose fist or a wooden spoon will help to activate qi in the chest and thereby help to resolve stagnations of phlegm and dampness.